And today we're just going to go over the Handtevy bag, a little bit about the design of the bag first of all, and then a little bit about the contents that could go inside the bag. So first of all, we have multiple zippered sections that you can access. It's obviously up to you and your local protocols and your needs as to what you put inside the bag. We're going to kind of talk about that. So one of the things that a lot of people will do is on the outside pouch, they'll put one of our Handtevy custom medication guides. These are customized exactly to your protocols, exactly what your dosages and concentrations are, and it breaks it down nicely with age. Has all the equipment as well as medications down to the milliliters. A lot of people will use the app as a primary means to access this information, but many systems will choose to have one of these backup guides on hand just as a non-technological backup. Also, I'm just going to kind of open up a couple of these sections, and you can see that there's pouches within a pouch and ways to access and store other equipment. Before I get into the center section here, I want to just kind of talk about how you could carry the bag. We do have a shoulder strap which can be removed if you want to. There are handles on both the side as well as the top, and that way you can hold it however you want to. We also have the ability to have backpack straps, and so I've already removed one of these to show you how that it can fit inside the bag and you wouldn't even have to have it. But if you wanted to use backpack straps, that's great, or you can kind of disconnect these and then hide them. So let's get into the center part of the bag, and it's nicely laid out. You can see we have the different color-coded pouches, which do correspond to the different colors of the length-based tape, as well as the app and the custom guides. This breaks things down nicely by age, which correlates to ideal body weight. So within each pouch, you see I'll open this up. A lot of people will put their IV start kit, oral and nasal airways, suction catheters, NG tubes, and ET tubes. Optionally, some people will put each individual blade that they need for intubation inside the pouch, and the pouches have plenty of room in order to put all of that type of stuff in there. We also have a way in the back if you wanted to put a stocking list into each pouch, and that way when you're restocking or if you throw this to whoever's doing procedures, they'll know exactly the contents within each pouch. BBMs, blood pressure cuffs, things for PPE fit nicely in this section. What we will have a lot of people do is if they don't want to put an individual blade in each of these pouches, they will have a blade set and their intubation handle, etc. in one of these pouches. We have plenty of room for syringes, saline bags, etc. for fluid boluses. Your three-way stopcocks, all that type of stuff can go in here. A lot of people will put an OB kit inside of this bag as well, and there's plenty of room to do that. That way, if you do a field delivery, you have all of the equipment that you need to resuscitate a kid at the same time. Additionally, I have here a backup length-based tape. And again, we always recommend the primary means of finding ideal body weight is to use age. But if age is not available, as Dr. Handtevy has kind of spoken about previously, we would use a backup link-based tape. And so this is housed as well inside the bag. So I hope that helps give you an overview of the design as well as the functionality. The contents, we have kind of a recommended guide for contents that you can download on the website. But again, that's optional, and it's just a guide for you to use. Thank you.